We are the only standing university campus for pediatric. We do trauma, respiratory. That being said, we have recently lost all our ancillary staff and personnel, which has affected our ratio, should I say, or affected our care. We find a lot of interruptions. And the reason I'm here today is because we had a code in our unit, and it sucked up our resources, which was all the nurses that we had on that day. And unfortunately, it was a delay in the call for more help. Circumstances turned out just fine, but it was a delay because we had no ancillary staff. So a group of us did look at the review that we reviewed and looked at the M&A, what they had submitted to us for the acuity tool, and we were in agreement that our patients and our practice, that the commission should include all of the M&A suggestions. We wish for you to keep in mind that nurses are the last defense at the bedside, and we are there delivering and evaluating care. So I just want you to just take for a moment and just imagine that somebody that you love is in our unit and they are currently intubated and vented, sedated. They require access as far as arterial monitoring, central line, and pressors. That nurse, unfortunately, in the background, that nurse right now is probably a one-to-one because that patient sounds pretty sick. But what you're hearing in the background is the phone ringing. And what you're hearing in the background is the doorbell. And it's a parent trying to get in, or it's a parent trying to call, or it's a physician that's trying to call. And unfortunately, that's being missed. So what we're looking for is that nurse shouldn't be distracted. That child in that bed deserves that undivided attention of that nurse. She does not need to be distracted. We also believe that as a critical care nurse, we're always assessing, evaluating, and intervening on behalf of our patients. And what you cannot measure is our thought process and our critical interventions. Thank you very much.